Here's how to dramatically reduce your knee replacement complication risk before your surgeon ever picks up a scalpel. Because most people don't know this, but knee replacement success starts even before the operation. A 2021 review that looked at 69 different studies covering thousands of joint replacement patients found that those people who optimized a few key factors before their surgery dramatically lowered their risk of a complication. I want you to get out the lab work that your primary care doctor ordered to clear you before surgery. And we're going to look through them, and I'm going to show you the key values that you want to look for to make sure that you're in tip-top shape. Number one is albumin. This is a protein made by your liver that shows us how good your nutrition has been and how well you're optimized to heal. We want this to be greater than 3.5. Number two is hemoglobin A1C. Now, you may not have got this ordered if you weren't diabetic, but if you are diabetic, this is especially critical. This shows us how well you've been managing your blood glucose over the last 3 months, and we want this 7.5 or lower. Next up is regular hemoglobin, which is different than hemoglobin A1C. Hemoglobin A1C measures your blood sugar, but hemoglobin measures how much oxygen your blood can carry, which is a good surrogate of your healing potential. If you're a male, you want this to be over 13, and if you're a female, you want this to be over 12. An absolutely critical one is your BMI, your body mass index. This is a measure of your height to weight ratio and shows us if you're too overweight and risking a complication following your surgery. According to the article, you want this under 40, but realistically, you want to try get this under 35. Even losing a little bit of weight is going to reduce stress on your joints and improve our chances of avoiding an infection. And then aside from your labs, there's two other things that we need to get under control. Firstly, stopping smoking. If you're a smoker, it's time to take a long, hard look in the mirror and do what you've been promising yourself for so long and finally quit. And number two, if you're on chronic opioids, I want you to cut down by at least 50%. Not only is it going to be great for your health, but it's also going to improve your pain control and avoiding a risk of a complication after a knee replacement. These are the key factors that I want you to have on track before surgery. I want you to step up and be a champion of your own health. You are the most important person in your recovery, and optimizing your health is your secret weapon to a smoother, easier, and more successful recovery.